Regarding regarding cast index, it is important to remember cast index, sagittal divided by coronal cast width at fracture site. An index of good molding and 3-point fixation ideally should be less than 0.8. Increase index, loss of reduction. Thermal injury, dipping, number 1, dipping water temperature more than 24 degrees centigrade. Number 2, more than 8 layers of plaster. Number 3, during plaster settings, limb placed on pillow because decreased dissipation of heat. Number 4, fiberglass wrapped over plaster. Regarding flexible nail of the forearm fractures, age group 7 to 15 years, avoid in adults as healing slower, which slow rehabilitation and less stable leads to non-union. Nail always placed in retrograde approach in radius to avoid pin. Distal lateral incision is given. There is a risk of superficial branch of radial nerve. A dorsal approach over Lister tubercle 2 cm proximal to distal radius 5-6 is also possible. There is a risk of EPL injury, this one. In ulnar nail can be inserted via antegrade 3 cm distal to the tip of olecranon and the lateral side, or retrograde approach on the radial side of the ulna to avoid injury to the ulnar nerve. Nail diameter 2/3 of the medullary isthmus, usually 2 mm in 7 to 11 years of age and 2.5 mm in 11 to 15 years of age. Start with more difficult fracture, usually it is radius. Turn the tip of the Nancy nail towards each other in supination to stretch the interosseous membrane. Remove at 4 to 6 months time or full circumferential callus formation. Complications, synostosis and refracture if removed less than 18 months of time. Need protection for 3 months after removal of the nails. The removal of plates associated with complications is 40%, wound sepsis, poor scar, nerve injury, refracture, growth arrest. Colares AOTS trial 2013, single bone intermedullary fixation of unstable both forearm diaphyseal fracture in children lead to increased redisplacement, so always put nail on both sides. The single fixation group cast immobilization period was longer as well, 37 versus 22 days.